Post-traumatic stress disorder, PTSD for short, is a psychological condition that develops after experiencing or witnessing a traumatic event. It affects individuals from all walks of life, causing significant distress and impairing their daily functioning. PTSD is characterized by a range of symptoms that persist long after the traumatic event. These symptoms can be categorized into 4 clusters: intrusive memories, flashbacks, nightmares, avoidance, avoiding triggers associated with the trauma, negative alterations in cognition and mood, persistent negative beliefs, emotional numbness, and alterations in arousal and reactivity, hypervigilance, exaggerated startle response. We will explore the nature of PTSD, also its specific impact on veterans, the use of medications, and the effectiveness of hypnotherapy as an alternative treatment, supported by relevant studies. Medications, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed to manage PTSD symptoms. These medications work by modulating neurotransmitters involved in mood regulation. While they can be effective for some individuals, it's important to acknowledge that not everyone responds equally to medication. Some may experience side effects or find that medication alone does not provide complete relief. Additionally, medication may not address the underlying causes of PTSD or provide tools for long-term coping. Effectiveness of hypnotherapy. Hypnotherapy, as an alternative treatment for PTSD, has gained attention for its potential in alleviating symptoms and promoting healing. Research studies have demonstrated promising results. Let's take a look at some of these. In a study cited on the American Psychological Association's PsycNet website, titled Hypnosis Practice Guidelines from the International Society for Traumatic Stress Studies, the Guilford Press, they concluded that there is consistent clinical evidence that hypnosis can facilitate, intensify, and shorten treatment. The consistency of clinical reports and observations going back for almost 2 centuries, coupled with some controlled studies, suggests that hypnosis is an effective and safe adjunctive procedure in the treatment of PTSD and other post-traumatic conditions. Veterans are at a higher risk of developing PTSD due to their exposure to combat and other traumatic experiences during military service. The impact of PTSD on veterans can be more pronounced, as the intensity and frequency of traumatic events experienced in war zones can lead to more severe symptoms compared to non-veterans. Veterans may also face challenges in readjusting to civilian life and may be at increased risk for co-occurring disorders such as substance abuse and depression. The National Library of Medicine website features a randomized controlled trial titled Hypnosis in the Treatment of Chronic Combat-Related PTSD Patients Suffering from Insomnia, a randomized, zolpidem-controlled clinical trial by Abramovitz et al. 2008, the study aimed to evaluate the efficacy of hypnosis in treating chronic combat-related PTSD in veterans who are also experiencing insomnia symptoms. The researchers compared the effects of hypnosis to those of zolpidem, a commonly prescribed medication for sleep disturbances. The study involved a group of veterans with chronic combat-related PTSD and insomnia. The participants were randomly assigned to receive either hypnosis or zolpidem for the treatment of their insomnia symptoms. The results of the study demonstrated that hypnosis was effective in improving sleep quality and reducing insomnia symptoms in veterans with chronic combat-related PTSD. The participants who received hypnosis showed significant improvements in sleep duration, sleep latency, sleep quality, and overall insomnia severity compared to those treated with zolpidem. This study highlights the potential of hypnosis as an alternative treatment for insomnia in veterans with PTSD. It suggests that hypnosis can be a valuable therapeutic intervention for improving sleep and addressing sleep disturbances associated with combat-related PTSD in veterans. And in the International Journal of Clinical and Experimental Hypnosis, a study titled A New Hypnotic Technique for Treating Combat-Related Post-Traumatic Stress Disorder, a prospective open study, Volume 58, 2010, Issue 3. We find that many combat veterans with post-traumatic stress disorder, PTSD, have an olfactory component to their traumatic memories that might be utilized by a technique called hypnotherapeutic olfactory conditioning, HOC for short. In this study, 36 outpatients with chronic PTSD, featuring resistant olfactory-induced flashbacks, were treated with 6 1.5-hour sessions using hypnosis. Significant reductions in symptomatology were recorded by the end of the 6-week treatment period. Use of medication was curtailed. The study concluded that HOC shows potential for providing benefit to individuals suffering from PTSD with olfactory components. There is also complex PTSD, where individuals experience some symptoms of PTSD along with some additional symptoms. The types of traumatic events that can cause complex PTSD include childhood abuse, neglect or abandonment, ongoing domestic violence or abuse, repeatedly witnessing violence or abuse, being forced or manipulated into prostitution, torture, kidnapping or slavery, being a prisoner of war. You are more likely to develop complex PTSD if you experience trauma at an early age. The trauma lasted for a long time. Escape or rescue were unlikely or impossible. You have experienced multiple traumas, and you were harmed by someone close to you. A report found in the American Journal of Clinical Hypnosis Volume 51, 2009 Issue 3 titled Hypnosis for Complex Trauma Survivors, for Case Studies, describes a treatment of complex trauma in 4 women. 2 women were survivors of childhood sexual abuse, one was a rape victim, and the other was a battered spouse. Data from self-reports, observation and objective measures indicates a significant reduction in the trauma symptoms after treatment. Additionally, in the American Journal of Clinical Hypnosis Volume 63, 2020 titled Applicability of Hypnosis to the Treatment of Complex PTSD and Dissociation. The article discusses the reasons why hypnotically structured treatment is particularly well suited for complex PTSD, explaining how each of the major aspects of this syndrome can be addressed within a hypnotic framework. Lastly, a meta-analysis study published in 2015 where 6 experiments were reviewed, revealed that hypnosis appears to be effective in alleviating symptoms of PTSD. As further research continues to explore and validate the efficacy of hypnotherapy, this alternative approach offers individuals the opportunity to empower themselves, overcome their PTSD symptoms, and reclaim their lives. Hypnotherapy provides a promising avenue for individuals to regain control over their symptoms and restore their overall well-being. As you've seen, there is empirical evidence to show that PTSD with a treatment plan including but not limited to stress inoculation, cognitive behavioral therapy and exposure therapy, that PTSD can be overcome. With the above treatment plan and customized suggestions during hypnosis, hypnotherapists are able to unpair the trauma's memories, including the sights, smells, sounds and feelings. Unpairing these triggers from the past, from the present, so the individual can live a normal life and resume normal activities. For more information and a free consult, please contact a certified hypnotherapist at www.lucyhypnotherapy.com.